My name is Kathleen Fitzgerald. Welcome to my stress management presentation on biofeedback therapy. What is biofeedback? In the simplest of terms, biofeedback is a mind-body technique. There are several methods that can be used to teach a patient how to modify their body's physiological responses. Biofeedback is a therapeutic tool that may improve and manage symptoms associated with physical, mental, emotional, and spiritual issues. According to a study done by Frank, Khorshid, Kiefer, Moravec, McKee, biofeedback in medicine states that clinical biofeedback may be used to manage and disease symptoms as well as to improve overall health and wellness through stress management training. How does it work? The process of biofeedback therapy can sound daunting, but another way to conceptualize biofeedback is to think of it almost like learning how to tie your shoes for the first time, or riding a bike for the first time. It's simply the development of a new set of skills which over time will become like second nature. During a biofeedback therapy session, a healthcare provider will attach electrical sensors to a patient's body. The type of sensors used will depend on the method of biofeedback therapy a patient's receiving and what they're being treated for. The electrical sensors monitor physiological state of the patient, for example, their heart rate, perspiration, temperature, etc. The information gathered by sensors are processed by a biofeedback program or device. After the information is processed, the device or program will send back cues, such as a beep or flashing light. Biofeedback sessions can last up to an hour or more and are repeated as often as necessary in order to yield the desired results. So rather than sitting back, a patient must be an active participant in order to engender relief for whatever condition they are seeking to relieve. It should be noted that this therapy allows the patient to manage their symptoms, not eliminate them entirely. Different types of biofeedback. There are at least 6 different types of biofeedback techniques. Brainwave. In this method, brainwaves are monitored using electroencephalographs or EEGs. Breathing. Breathing and respiration rates are measured with this method of biofeedback. Heart rate. Heart rate and heart rate variability are measured using an electrocardiograph or ECG, which is placed on the patient's chest and torso. Muscle. For this method, muscles' electrical activity is measured using electromyography or EMG sensors, which are placed on the patient's skeletal muscles. Sweat glands. An electrodermograph will measure the activity of a patient's sweat glands. Sensors are placed on the fingers, palms, and wrists of the patient, and what is measured is how much perspiration is present on skin at the time of therapy. And finally, temperature. This method is similar to the sweat gland method in that the sensors are attached to the hands, and in this case the feet as well, and measures the blood flow to a patient's extremities. Temperature can be used as an indicator of measuring when a patient is under duress. Who can benefit? Biofeedback therapy has positively impacted numerous patients' lives by helping manage their particular health-related issues, such as headaches, managing stress, incontinence, and the list can go on. Proof of these benefits can be found in studies done like the one by Greenberg, Grossman, Bulwell, Rainyard, and etc. They studied the effectiveness of biofeedback therapy on patients who were diagnosed with non-small cell lung cancer. During their study, they observed patients, and these patients learned not only how to reduce their stress, but they also improved their coping skills, their respiration rates, and heart rate variability. And finally, why use biofeedback? Well, biofeedback can appeal to people for a variety of different reasons. It's non-invasive. It reduces, or in some cases can eliminate, the need for more medications. It's an alternative treatment, and it has been useful in reducing and managing symptoms of different mental, physical, emotional, and spiritual ailments. And finally, it helps people take charge of their health. It should be noted that while biofeedback therapy can sound like a one-size-fits-all treatment for a variety of symptoms, it may not be successful for everybody. Biofeedback can help prevent, treat, and manage symptoms of your conditions. But with that being said, it does not mean that you should stop your regular treatment plan with your healthcare provider. Biofeedback is best used in conjunction with a patient and provider collaborating on a treatment plan that is best suited to their needs. Thank you for joining me today on my presentation about biofeedback therapy. Goodbye.